Okay, in this video we're going to talk a little bit about medical issues that you can expect to have with your foster kitten. So these are medical issues that you should definitely prepare for because they are very likely to happen. So to start out with, diarrhea. That's one of the most common things that happens in kittens. And this is because, their gut bacteria are not built up as much as an older cat. So things to look out for are if they are having diarrhea. We have a fecal scoring chart that is provided to you in the foster kits. Now these show the different levels of diarrhea or just poop in general that they may have. And you'll want to refer to this if you suspect that they are having diarrhea, so you can tell the medical team exactly what's going on with them. Now if they are having diarrhea and it seems like it's been going on for more than a day, definitely contact a medical team, and what we'll do is probably set up a pickup where you can, or a drop off where you can drop off their stool sample here at Paws, and we'll either run a fecal in-house or we'll have you send it out to another hospital so that we can determine whether or not they have any parasites or bacteria issues that are going on with that. So then we'll likely give you medications to solve this issue. So that's diarrhea. So another thing that you'll probably see is our eye issues. Eye issues are very common in the younger foster cats. So things that we'll probably see are bacterial infections. So things to look out for are if they're having any eye discharge, typically both eyes. If it's yellowish, brown, or green in color, that's probably an issue that you want to talk with the medical team about. If you're seeing any redness or swelling, definitely let the medical team know that as well. If they're having any issues like scratching or pawing at the eye, stuff like that, those are all issues. And likely what we'll do is probably give you some sort of medication to place into the eye. So those are all things definitely contact the medical team about. Other things that you may run into are upper respiratory issues. And that may also go hand in hand with some of the eye things that you'll see. So like if you're seeing eye discharge, make sure you're also watching for upper respiratory issues such as sneezing, or if they sound congested or anything like that, like there's mucus coming out of their nose. Those are things to look out for. You might see one or the other. So if if a cat's having upper respiratory issues, they may not have eye issues, but they may also have eye issues. If you're seeing a cat that has eye issues, they may have upper respiratory issues, but they may not also. So I hope that makes sense. If another thing to watch out for is obviously if your cat has any fleas or anything like that. So if they are younger than 8 weeks old, we can give them a Capstar to help kill off any of the fleas. If they're older than that, they will have likely gotten Revolution to kill off fleas, so you should not be seeing that in cats probably older than 8 weeks, but if you are, definitely contact the medical team to let us know. Ways to be able to determine if they are is if you have a flea comb or just any sort of comb running it through their fur. If you're seeing any sort of what we call flea dirt, there's little black and red specks in their fur. If you're concerned about it, let us know. Sometimes you may not see any live fleas though. If you do see live fleas, that's an indication that there's probably an active infestation going on. A couple other things maybe you'll see are constipation. That goes hand in hand with diarrhea. So if a cat is having constipation where it's either not producing stool or it seems like the stool is very firm, we may give you some instructions on what to do with that, maybe a medication such as Miralax or something like that to soften some of the stool. So definitely let us know. For the most part, those are some of the main issues that you will see with your foster kitten. There may be other various medical issues that we may instruct you to give medications on, but for the most part, those are the main things. So if you have any questions about any of that, or if you have any questions about what's going on with your foster kitten, let the medical team know.